Did you know that nearly half of people with chronic kidney disease, or CKD, struggle with high potassium levels? Hyperkalemia, or high potassium, is one of the hidden risks that can push CKD into more advanced stages. And some of the fruits you consider healthy and kidney-friendly contain high levels of potassium that might secretly be damaging your kidneys. But potassium is not the only one. There are also many other seemingly beneficial nutrients in healthy fruits that can be problematic for your kidneys. So, in this video, let's learn about 11 healthy fruits that may be secretly damaging your kidneys. We'll tell you why these fruits can be problematic, how they affect your kidney health, and if there's a way to safely eat them. Let's begin. Fruit number 1 on our list is banana. It's true that bananas contain several nutrients like vitamin C, vitamin B6, and magnesium, all of which are great for overall health. But the thing is that bananas are loaded with potassium, and that's where the problem lies. Healthy kidneys usually have no trouble filtering out extra potassium from your blood. They can effectively filter excess potassium and remove it from blood. However, when you eat an excess of bananas, your kidneys have to work harder to filter high amounts of potassium, which can strain your kidneys and damage them. Moreover, your kidneys might also not be able to filter all the potassium, due to which potassium can start to build up in your bloodstream, leading to a condition called hyperkalemia. Hyperkalemia can cause irregular heartbeats, weaken your heart muscles, and in severe cases, even lead to a heart attack. All these heart issues can reduce blood flow to your already struggling kidneys, worsening the damage and increasing the risk of kidney failure. So, if you have CKD, keeping your potassium levels in check is crucial. For most people with kidney disease, the allowed daily potassium intake is below 2,000 milligrams, and a single medium banana packs about 400 milligrams of potassium, so eating them too much, or along with other high potassium foods, can quickly push your potassium levels over the limit. That's why most kidney experts suggest either limiting bananas to once or twice a week, sticking to smaller portions, or even skipping them altogether. Moreover, everyone's potassium needs are different. Some people might be able to enjoy a small banana or a large one, while others may need to avoid them completely. That's why it's so important to talk to your doctor or dietitian to figure out what's best for you. Number 2. Avocados. Avocados are a nutrient-dense fruit packed with fiber, healthy fats, potassium, and nearly 20 vitamins, minerals, and antioxidants. Studies show that their fiber and healthy fats can help manage blood sugar, blood pressure, cholesterol levels, and gut health, which are essential for overall health and kidney health. Also, avocados are naturally free of sugar, cholesterol, and sodium, but this is only one side of the picture. Avocados also contain too much potassium. One serving of avocado, which is 1/3 of a medium avocado, provides around 487 milligrams of potassium, which is a significant portion of the daily allowed intake of potassium. So it clearly suggests that you may need to avoid it, especially if you have kidney problems. Or instead of eating a whole avocado, go for a smaller portion, such as 1/4 of an avocado. Number 3. Kiwi. Kiwi is a nutrient-dense fruit rich in fiber and several vitamins and antioxidants, all of which play a role in improving overall health. However, kiwi also contains a significant amount of oxalates, which is around about 36 milligrams per medium kiwi, making it a moderately high oxalate food. High oxalate levels can contribute to kidney stone formation by binding with calcium in the urine to form calcium oxalate crystals. These crystals can grow and aggregate into stones, especially when urine is concentrated or lacks enough substances that inhibit crystal formation. So eating kiwi in excess can be unsuitable for individuals prone to kidney stones. Additionally, the potassium content in kiwi, which is about 312 milligrams per serving, is another reason you may need to avoid to prevent any further kidney damage. Cooking techniques like boiling, pressure cooking, and microwaving are effective methods for reducing potassium levels in various foods. However, when it comes to kiwi, these methods are not as effective. This is mainly because kiwi is typically consumed raw and has a soft texture that makes it hard to reduce potassium content by traditional methods. Therefore, portion control remains the best strategy for managing potassium intake from kiwi, especially for individuals with chronic kidney disease. Number 4. Orange and orange juice. Oranges and orange juice are popular for their high vitamin C content, but they are also rich in potassium. A single large orange of around 184 grams contains approximately 333 milligrams of potassium, while 1 cup of 240 milliliters of orange juice provides about 458 milligrams of potassium. Another reason why oranges can cause kidney damage is their high vitamin C content. While vitamin C is essential for overall health and has been linked to reduced risks of certain cancers, excessive intake can increase the chances of kidney stone formation. One medium-sized orange of around 140 grams contains around 82 milligrams of vitamin C, which nearly meets the recommended dietary allowance for people with CKD, 90 milligrams per day for men and 75 milligrams per day for women. Consuming more vitamin C by consuming excess oranges or orange juice can potentially increase the risk of kidney stones in high-risk groups. Now, you might have heard that the citrate in oranges can prevent calcium oxalate stones by binding to calcium. While this is true, the risk of kidney stones from excessive vitamin C might cancel out this potential benefit for people with CKD. As a result, oranges and orange juice are generally recommended to be avoided or limited on a renal diet. Number 5. Dates. Dates are rich in vitamins, minerals, and powerful antioxidant compounds that can help boost your immune system, reduce inflammation, protect your DNA, and even improve hormone balance. On top of that, dates also contain selenium, an important mineral that can help lower the risk of prostate and bladder cancer. But if you have kidney problems, dates might worsen your condition. They're high in potassium, and just one medjool date of 24 grams has about 167 milligrams of potassium. For people with chronic kidney disease, eating 3 to 4 dates in a serving can contribute to overall potassium intake and might lead to advanced stages of kidney disease. That's why people on a kidney-friendly diet are usually told to avoid fresh and dried dates, along with other potassium-packed dried fruits like apricots, prunes, and raisins. Since dried fruits are more concentrated in nutrients, consuming them can cause more harm than fresh dates. This is because nutrients like potassium are more concentrated in dried fruits, and consuming only a small portion may cause a spike in potassium levels. Try eating 1 date a day. This can prevent any serious spikes in potassium levels, or ask your kidney dietitian to manage its portion size based on your potassium needs. Number 6. Coconut. This nutrient-rich fruit is rich in protein, fiber, and many essential minerals such as iron, manganese, copper, and magnesium. Along with other beneficial compounds, coconut offers several health benefits, including reducing inflammation, killing harmful bacteria, easing pain, and even treating diarrhea. Most healthy people can enjoy coconut and its products safely. However, people with kidney disease might need to avoid this fruit in their daily diet. But why? Coconut products, like coconut water and coconut meat or edible white flesh, are high in potassium and sometimes sodium, which can be harmful to your already damaged kidneys. Coconut water, for example, has about 600 milligrams of potassium per cup, which is more than a banana, and about 252 milligrams of sodium. Plus, coconut meat, including shredded coconut, is also high in potassium and isn't kidney-friendly for most people managing CKD. However, you can try some safe ways to add coconut to your diet. For example, if you try adding a small amount of unsweetened shredded coconut as a topping or in recipes, it can add flavor without overloading your kidneys with potassium. But avoid drinking coconut water as its potassium content is relatively higher than coconut meat. Number 7. Mangoes. Mangoes are a delicious and nutrient-packed fruit that offers several health benefits as they are rich in vitamins A, C, and E, which support immune health, improve skin health, and protect cells from damage. It also provides minerals like potassium, magnesium, and calcium that are important for muscle function, fluid balance, bone health, and various health benefits for most healthy people. However, mangoes are also rich in potassium. The amount of potassium in one mango may be as high as 564 milligrams, so it is considered a high potassium food. So it is best to limit its intake. Moreover, overeating mangoes or consuming them as juice can also elevate blood sugar levels, which may be harmful to both kidney and diabetes patients. This is because high blood sugar levels can damage the small blood vessels in the kidneys, reducing their ability to filter waste effectively. Over time, this can lead to protein leakage in the urine and a condition called diabetic nephropathy. If not managed, it may progress to chronic kidney disease or kidney failure. So controlling blood sugar is essential to protect kidney health. However, the good news is that you can still eat mangoes in moderation. Stick to small portions, such as a few slices, and avoid mango-based drinks or desserts with added sugar. Number 8. Apricots. Apricots are a nutritious fruit packed with vitamin C, vitamin A, and fiber, which makes them a healthy choice for most healthy people. Although these vitamins support immune health, improve vision, and help in digestion for individuals with chronic kidney disease, apricots may not be the best option due to their high potassium content. Fresh apricots contain significant amounts of potassium, with 1 cup, which is around 165 grams of sliced apricots, providing roughly 427 milligrams of potassium. Dried apricots, on the other hand, are highly concentrated in potassium. Just 1 cup of 130 grams of dried apricots contains over 1,500 milligrams of potassium, which is 75% of the 2,000 milligrams limit typically recommended for a low-potassium diet for kidney patients. Because of this, both fresh and dried apricots are best avoided by individuals following a kidney-friendly diet to manage their potassium levels effectively. Number 9. Starfruit. Starfruit is a fruit you may want to think twice about, especially if you have kidney disease. This is because starfruit contains a neurotoxin called caramboxin. This neurotoxin is usually filtered and eliminated from the body by healthy kidneys. However, for those with already damaged kidneys, the toxin builds up in the body, especially the brain, potentially leading to serious health problems. These include mental confusion, seizures, and in severe cases, even death. Regular consumption of starfruit can also worsen kidney function over time and increase the risk of these complications. In addition to its neurotoxin content, starfruit is extremely high in oxalates, with 100 grams of raw starfruit containing over 295 milligrams of oxalates. As mentioned earlier, foods high in oxalates can contribute to the formation of kidney stones and further damage to already weakened kidneys. For individuals with chronic kidney disease, consuming even a small portion size of starfruit can worsen kidney health and increase the risk of kidney stone formation and severe kidney damage. So, it's best to completely avoid starfruit and its juice if your kidneys are already weak. Even small amounts, especially on an empty stomach or when dehydrated, can significantly raise the risk of toxicity. Number 10. Melons. Melons are hydrating and packed with several nutrients, including lycopene, a powerful antioxidant. Watermelon contains more lycopene than any other fruit or vegetable. Studies suggest that lycopene may help lower triglycerides and bad or LDL cholesterol and can even play a role in preventing prostate cancer. For kidney patients, eating too much watermelon can pose significant risks due to its potassium and fluid content. A wedge of watermelon may have as much as 560 milligrams of potassium, but a smaller 1-cup serving contains only around 180 milligrams of potassium. Eating more can exceed the daily limit for those on a low-potassium renal diet. Similarly, even smaller portions of other melons, such as cantaloupe and honeydew, can also add to the potassium load, making portion control essential. Even though watermelon is considered beneficial due to its water content, its 92% water can pose challenges for those on a fluid restriction. This can quickly add up and cause fluid overload, which puts additional strain on your kidneys. So, how can you enjoy watermelon safely? Stick to a 1-cup serving and be mindful of how it fits into your dietary plan. Number 11. Grapefruit. Grapefruit is a nutrient-rich fruit packed with vitamins A and C, fiber, and lycopene. However, it contains moderate levels of potassium, 332 milligrams per half fruit, which can be concerning for people with kidney problems, especially when consumed in large amounts. To prevent any further kidney issues, even a moderate portion of grapefruit should be consumed with caution. Beyond its potassium content, grapefruit juice can also interfere with certain medications, such as those used to manage cholesterol and high blood pressure or prevent organ transplant rejection. It can alter how drugs are broken down or absorbed in your body, leading to either too much or too little of the medication in your system. This imbalance can result in serious health problems like muscle damage, liver injury, and kidney failure. That's why it is important to consult your healthcare provider or dietitian before including grapefruit in your diet. Moreover, always check the information that comes with your prescription or over-the-counter medication to see if it might be affected by grapefruit or any other foods in your diet. Thanks for watching. But that's not it. If you want to know more about how you can improve your overall kidney health, make sure to watch these videos too.